Hello, hello, and welcome to the Dr. Toomer Talk Show on Tuesday. How's that for an alliteration? If you say it fast 10 times. I'm Dr. Catherine Toomer, family medicine and community health physician and founder of Total Weight Care Institute, where I help people maximize their health and wellness through very targeted weight care practices, particularly in a system that's very complete and very compassionate. I became the doctor I needed before I lost 100 pounds, when I needed help to lose my weight and to survive my postpartum cardiomyopathy or pregnancy related congestive heart failure, as well as my insulin dependent diabetes. And I also teach physicians and their mid levels how to provide the same for their patients so that their patients have the best care and the best health outcomes, and the physicians have financial freedom and time autonomy, which is something that I actually enjoy in my practice, that I've created for myself. And one of the things that happens from being in practice now for over 20 years. I graduated from medical school in 1996. I started training in family medicine then. And so that was almost 30 years ago. And so I have seen a lot. And one of the things that I see, and some of the things that often happen, is I ask people about their numbers. And they come in, either because they're not feeling well or because something's been off. And usually, often it's someone who may have seen doctors regularly and often ask, "What are your numbers?" And they say they're good. I was told they were good. And then when I check them, they're not good. And then when I go back and look, I can tell that their numbers have been creeping towards not being good for some time. And so one of the problems that I always say is our body does not read textbooks. And so when we are feeling bad, sometimes our numbers may be just on the verge of normal, but that doesn't mean they're good. And so I always say treat the person, not the numbers. If someone, if it quacks like a duck, it walks like a duck, it's a duck until proven otherwise. And so there's a few things that I often say for people who really truly want to be healthy, who want to understand their health and want to stay on top of their health. There's a few numbers that they just always should know, and not good or bad, but the actual number. So I want you to have a piece of paper and a pen. And I want you to write some things down, because these are things that it took me a while to remember them from medical school. So, if they're things that you may have to refer to, you can write them down in a medical book that you keep with you, that you take with you to the doctors. I always recommend that you have a little notebook that you write your questions in. Um, and the doctor's answers. It's very easy, even for me who's in medicine. I'll only remember about half of what my doctor is saying in an appointment. And I need to write things down just to remind myself later what it is I'm supposed to do and pay attention to. And so I always recommend keep something with you to write. And so that's what we're going to do today. And before we get started, I just want to say to Shelly, he said Jambasana Daktari. For those of you who don't speak Swahili, that says hello. Very hello from a doctor, essentially. And so thank you for joining, Shelly. It's really great to see you. Um, and so there's five that I'm just going to pull out today. I don't want to, bombard you with a lot of information, but definitely these are the ones that you should always know. Some of these you can even check at home. And so they're good to know. So the number one is your blood pressure. You need to know the number of your blood pressure, not just whether it's good or whether it's bad, but the actual numbers, because sometimes they have what we call the systolic over the diastolic, and that sometimes one or the other number could be normal and the other one abnormal or out of range. And when that happens, it gives indications of something happening. And and that's something that, even if someone says they're good, you can ask, why is it good? Why is it not something that needs to be addressed? And you can get an answer. Because sometimes, even when numbers aren't exactly perfectly normal, what's considered textbook normal, there still can be a reason just to watch and see, or to give you the opportunity to maybe make some changes to see if your body responds. And so when it comes to blood pressure, normal is usually want to see around 135 over 85 or lower. Now, if it gets too low, of course, that's hypotension, and then that can cause some dizziness and other things. But for the most part, I'm talking about hypertension. You want to make sure that your blood pressures are within a normal range. So 135 over 85 or under. Now, when you start getting over the 135 towards the 140s, we start paying attention, or the 85 to 90, we start paying attention. When it starts going over consistently over 140 over 90, then we start to get concerned and we want to start paying attention. And it's not just one reading. Now, we want to watch it for a few readings. 2 to 3 times. Um, and so, but because of the way, at least in the US, the way insurance and the way medical system works, sometimes it's hard to get into a doctor once a month to recheck your blood pressure. Sometimes it's just a nurse visit, just to recheck so the doctor can get the information and chart it. But you can also check it at home. And so when your blood pressure is particularly when it's consistently over 140 over 90, if it gets over 145 over 95, we really get concerned and we want to start treating. Now, there is something called white coat syndrome or white coat hypertension, where some people, their blood pressure only goes up when they're in the doctor's office, but it doesn't happen at home. So this is what I always suggest. Get a blood pressure cup that you can use at home. Check your blood pressure every morning. Write it down. At least 7 readings once every single day through the weekend, through the days you go to work, during typical activity. And then you take those readings and the blood pressure cuff with you to your next doctor appointment. So what happens is that we'll check your blood pressure using our machine, but then we'll also check your blood pressure using your machine and see if they're exactly the same. If they are the same in the doctor's office, then we can trust the readings that you got at home. And we know, yes, this is just from you being in the doctor's office. However, if they're not the same, and the one in the office shows either to be a little bit higher or yours shows, we can always determine which is the more accurate. But we need to be able to trust the readings you get at home, or at least know that they're, whether we can trust them or not and document them or not. And so we have to check your blood pressure at the same time with your cuff and the physician's cuff. And so, so when we treat hypertension, high blood pressure, it really just depends on who the patient is, what other issues they have going on, how old they are, what have they responded to in the past. And if there's ways that if it's mild enough, so maybe we can just change some lifestyle things to bring it down, or if we're going to need medication to prevent any complications. And those complications are cardiovascular in nature, meaning that any place where there are blood vessels that are supplied by blood vessels and there's high blood pressure, those organs can be affected. Now, the reason they can be affected, and I'm going to explain this very clearly. Imagine, have you ever seen something being pressure washed, where high pressure water is being used and it can strip off dirt, mold, grime, all sorts of things, paint off of a building. So imagine if something under high pressure can strip something off the side of a building. So imagine if you have high pressure inside of your blood vessels, which is basically what hypertension is, increased pressure inside your blood vessels. So if you have high pressure inside the blood vessels, that pressure is stripping the inside of your vessels. And when you have a closed vessel and the inside are being stripped, it gets weaker and weaker and weaker, and things start to happen. Either they get rough on the inside and cholesterol can collect that's in your blood, or they burst and you end up with aneurysms, like aortic aneurysms, or blood vessel burst in the brain. You have hemorrhagic strokes. There's so many different things that can happen. End organ problems, kidneys start to be affected, heart starts to be affected. All those little vessels that supply oxygen to our organs are affected. And so all our organs get affected. And so that's why it's really important to know those numbers, because this happens over years. So if you catch it early and you do something about it early, then that damage is not done, or at least not as much, but it is definitely reversible. And so Yeah, so you don't want to let it go untreated. So it's really important to know your blood pressure numbers. Know your numbers, not whether it's good or bad, but your actual numbers. Number two is your hemoglobin A1C. And what your hemoglobin A1C tells us is what your blood sugars have been doing over the past 3 months. It's an average. Now, when your blood sugar goes up, sugar attaches to red blood cells in our blood. And we can measure how much sugar has attached to our red blood cells, and that's what gives us our A1C. The higher your blood sugars have been and the longer they've been high, the higher your A1C number. And that's why we can tell when someone's becoming a diabetic. Now, when they're diabetic, that number is 6.5 or higher. But there's pre-diabetes, which is 5.7 up to 6.5. And then there's pre-diabetes, which is below 5.6. And what we often call that is either normal or it can be insulin resistance. And when it's insulin resistant, you can actually have a very low hemoglobin A1C and still be on your way to having diabetes. And that's why when you suspect there might be some sugar problems going on, you can check your blood sugars within an hour after eating to see what they are. And you want those blood sugars to be under 140, but that's something you can talk to your doctor about. Talk to a diabetic educator or a nutritionist, and they can teach you how to use a glucometer in order to check your blood sugars. But an A1C is the number that tells us where you are on the diabetic continuum. That number is very important, and it's an important number to know. Now, even if that number is quote unquote normal, it doesn't mean that you don't have blood sugar issues. So there's other things we watch for, but at least starting there is important. And we usually check that once a year if it's normal, if it's under normal range, but we start checking it more frequently if we start seeing it climb. I personally start treating very early. If I see a change in blood in the A1C, if it starts to climb, I don't wait till it's abnormal to start bringing it back down, particularly if there's other things going on, because during the phase before diabetes shows up, our body becomes very efficient at making fat out of food rather than fuel, and our weight just goes up and up and up, and it starts this vicious cycle. And so it's an important number to know. And so the way we treat a high hemoglobin A1C is using medications. There's different pills. We've all heard about Ozempic and Manjaro and other GLP-1s, and they work. And the reason they work so well is they bring blood sugar down and they stop and reverse fat production. And that's why they work for weight loss as well. And so, but if it's untreated, if it's allowed to go, then what happens is blood sugar not only attaches itself to red blood cells, it also attaches itself to the inside of blood vessels. So it makes the inside of blood vessels very rough and very stiff. And so when blood vessels are rough and stiff, a couple of things happen. One, cholesterol, again, sticks to the inside of it. And two, if blood pressure goes up, they aren't compliant. And so what happens is they burst. So again, you can see why there'd be a nasty combination of having hypertension and diabetes, because they all affect the same blood vessels and then the organs that those blood vessels supply. The third number is cholesterol. Not just your total cholesterol, but you want to know what's considered your good cholesterol, which is HDL, and the higher the better. Our LDL, which the lower the better, which is the bad cholesterol, which we want to see, our LDL, we want to see under 100. And our HDL, our good cholesterol, we want to see over 40. Now, the higher the number of the good, the better, and the lower the number of the bad, the better. Now, one of the things we're also looking at, depending on what those numbers are our what's called our VLDL, or very low density lipoproteins, which is basically really bad cholesterol. We want that number to be low. And if the really, really bad one is called alipoprotein. Now, that one is what often is connected to heart disease. Well, they're all can be connected to heart disease if they're out of range, but that's really important. So those numbers are important to know. Um, and I'm going to give you the actual numbers. Um, Now, total cholesterol, like I mentioned, you want it to be under 200. The bad cholesterol, you want to be under 100. The good cholesterol, you want it to be over 40. And the VLDL, the very low, the kind of bad one, you want it to range between 2 and 30, because otherwise you can end up with a fatty liver, with clogged arteries, and we don't want that. And then the lipoprotein A, you want it to be less than 30. Anything over 50 puts you at risk for heart disease. So those are numbers you can ask your doctor to check. They are blood tests and they are easily checked, and you can ask your doctor to check them once a year, particularly if you have a family history of heart disease or you yourself have a history of hypertension or diabetes. You want to know what your cholesterol is. Um, and so the way you treat these is using cholesterol lowering medications, but like any medications, they have side effects, and some worse than others. Some of those they cause achiness. In men, they can drop cholesterol so low that their body can't make testosterone, and that can cause some other secondary problems. So, prevention is better than a cure. So it's always really important to watch your cholesterol intake, which is fat, animal-based fats, and switching to a predominantly plant-based diet is also helpful. Stress reduction, by reducing stress, we reduce our body, because we have fat and cholesterol stored in our liver, and one of the things that happens when we're under stress is that fat gets released into our system. So keeping our stress levels down helps with that. Exercising daily is another. The more we use our body, the more that energy gets used for other things and good things rather than just floating around and causing problems. And so, again, if left untreated, it leads to cardiovascular disease, heart attacks, strokes. Any place you don't want arteries to be clogged, they is basically what you're protecting in that situation. And the fourth number is something I talked about last week, and actually last week or the week before. The waist to hip ratio. That's something you can actually measure at home. So how you measure your waist to hip ratio is you take a tape measure, a flexible one, and you measure from the smallest part of your waist, which is often somewhere between your ribs and your hips, but usually like right above your navel or right about at the level of your navel. And you measure from the smallest part of your waist and you write down that number. Then you measure from the widest part of your hips and you write down that number. And what you do is you calculate the waist number over the hip number. If you're a woman, you want that number to be less than 0.86. If you're a man, you want that number to be less than 1. When those numbers are higher than 8.6 in women or 1 in men, what that means is that there's probably a lot of what's called visceral fat in our body, which is fat that deposits through our middle around organs, which makes them less efficient, which also makes it is a good or an indicator of preventable health issues. And so, and the way to help with that number is by the same way you would to correct anything metabolic or anything weight related, and that is through muscle work, low carb, high protein diet, exercise, stress reduction, um, and body fat, just overall body fat reduction as well. And so it's just an important number to know and to pay attention to. Because one of the things that happens is it's sometimes the only indication that something else is going on. your number, because it's not like we check our blood sugar all the time. It's not like we check our blood pressure all the time, or you could, but or even that you get blood work all the time. But you can measure your waist to hip ratio. And that number, if you start seeing a change, could be an indication of something going on. That's something you need to alert your doctors for, and they can look for something else. And so that's why that number is really important to know. And the fifth one is BMI. Now, BMI, body mass index, is not the best number for anything other than to kind of, in the whole big picture, it helps us to kind of get an idea of what's going on. A high BMI is often connected to certain health issues. And so it's good to know what they are, and it's good to not be in denial, because we may like the way we look, we might like the way we feel, but that doesn't necessarily mean that we're in the best of health. And so sometimes, there could be things going on that we can prevent for later. And so what is considered a normal, quote unquote, BMI is between 18 and 24. Now, when I say normal, our body doesn't read textbook. One. Two, if you're more muscular than most people, you are going to have a slightly higher BMI. Now, I'm not talking about being big boned, because we all know that some of us, I know I was one of them, who used to say, I'm not overweight, I just have big bones, when actually I truly don't. And the way that's measured is through our wrist, but that's going to be another topic for another day. So when it comes to BMI, like I said, under 18 is underweight, 18 to 24 is considered normal weight, normal BMI, and then from excuse me, from 25 to 30 is considered overweight. From 30 to 35 is class 1 diabetes. 35 to 40 is class 2. Over 40 is class 3. Now, as someone who had class 3 obesity, I can tell you there are a lot of mechanical musculoskeletal things that happen, aches and pains, a lot of inflammation, joints, especially weight-bearing joints, ankles, knees, hips. It's just associated with a lot of health issues. And so we want to make sure that at least to pay attention to the number. Now, sometimes it's just the change in that number. Sometimes it's the number itself. But again, by itself doesn't mean a whole lot, but it's a good indication that we should start paying attention. The treatment for a high BMI is anti-obesity medications. So those are medications that, like GLP-1, the Ozempic, or I should say Wegovy, and the Zepbound and Saxenda are the ones that are actually designed to treat BMI, or someone who's overweight or obese or has obesity. But there's also lifestyle changes that we can do, like focusing on protein in our diet, focusing on plants and fibers in our diet, building muscle. Muscle is a wonderful metabolic tool at our disposal. And it's always important to start low and go slow. Of course, when you start off, muscle may not be the greatest part of our intervention, but over time it becomes more and more important, especially the better we get and the more time we put into it. The other is it's really important because there's psychosocial improvements. And now psychosocial improvements can be not only part of the treatment, but it's also the improvement is part of the result of doing something about it. And so one of the things that we do is mood stabilization. Make sure that people have social outlets, they're not isolated, because those are some of the things that happen if we ignore our BMI, if it starts to climb, if it's already high and starts to climb. And so with untreated, you get we just know that fat cells in our body just put out all sorts of chemicals, and those chemicals can cause all sorts of issues, and which increases our cancer risk, which increases our muscle issues and our joint issues, which lowers our immunity, and we get sick. We get ill much more easily. Autoimmune diseases are higher rates. Metabolic disease, like diabetes, we already know this, and it's kind of hard to tell which came first, the chicken or the egg. If the the blood sugar issues cause the diabetes. I'm sorry, cause the weight gain, which then causes more worsening diabetes, and it starts this vicious cycle. And then again, the psychosocial issues, depression, anxiety, social isolation, socioeconomic impact. Study after study has shown that people who are perceived as being overweight or having obesity often have um, lower paying jobs or get paid less within their jobs. And although that's not fair, we know a lot of times where things that we are beyond our control are not fair and things that happen, but that's just the reality of it. And so I'm just going to run through these again very quickly. So there are 5 numbers we should know: blood pressure, A1C, cholesterol, waist to hip ratio, and BMI. Now, there are other numbers that lend themselves to health, and those are things you can talk to your doctor about. And also, it just is case dependent. If you have certain, issues, health issues, you want to know numbers that pertain to that issue. And so, if you have prostate cancer. Now, one thing I didn't add on here, and it was a mistake, and I should have added. There should be 6 actually. For men, men should know their PSA, which is their prostate hormone, to watch it and see if it starts to climb. We catch prostate cancer early. The other is our complete blood count. Now, our complete blood count is what shows us if we're anemic or not. And if we have anemia, there could be a reason. Usually it's from blood loss. And for most women who are still menstruating, that's what the cause is. And for men, though, who are anemic, often it's from their colon. And we want to make sure there's not some underlying cancer. So again, those are also numbers. But really, anything that shows or gives you an idea of what your health parameters are, you should know the actual number, not whether it's good or bad, but what that actual number is. Have it written down so no matter who you see, no matter what doctor you go to, you have that information to provide to them. And if you don't have that information, get it. Either because, if you haven't had blood tests in a while, if you haven't seen a doctor in a while, if you just want to know, where you are and what your status is, it's really important to keep on top of your health status, because prevention is so much easier than reversal once you've got something. And so before I start taking questions, I do want to say thank you, Shelley, for being here. Thank you, Chris, for always supporting. Ursuline, good afternoon. Thank you for being here. Lisa Campbell, saying this is such good information. Thank you. Thank you for being here. I really appreciate people who show up, and I really appreciate questions. Dr. Corday says, oh, see Dr. Catherine Tudor on lovely Oak Bluff on Martha's Vineyard, Tuesday, August 13th. Yes. Now, on August 13th, I will be speaking. I'll be a part of a program called Sisters in the Vineyard. And if you want to know more about it, the tickets are $150. It is going to be, we're going to have 2 celebrity guest speakers, one Sunny Hostin from The View, and Malik Yoba from many different things, but he's one of my favorite actors from long ago. But he will be there too. And it's sistersonthevineyard.com if you want more information and you want to buy tickets. Dr. Barbara Joy, thank you for coming. Jennifer, should I consult a dietitian for an eating plan for a menopausal weight gain? Now, when you have menopausal weight gain, honestly, the best way to prevent and reverse metabolic weight gain is to act like a diabetic. The reason you're gaining weight is for the exact same reason that diabetes causes weight gain. And what that is meaning is that as our estrogen drops, our cortisol it becomes unopposed. As our cortisol becomes unopposed, our insulin levels start to rise, and insulin resistance also goes up. And so our body starts thinking we're diabetic and starts acting like a diabetic. So learning how to maximize protein and reduce carbohydrates like a diabetic should, yes, a dietitian could help with that. And then, and then also, to be honest, you can go through some of my videos on YouTube. I have several, like how to prevent diabetes, and it's exactly the same thing. You just act like a diabetic. And so you watch refined sugars. You stay away from sugars in liquids, soft drinks, sodas, and that sort of thing. So yes, a dietitian could help. And mind you, now there's a difference between a dietitian and a nutritionist. A dietitian is educated in diet and is trained. A nutritionist is someone who, you know, they could be trained, they may be certified, but it could also be someone with just an opinion. So you want someone who is a dietitian, who is actually educated in the field of diet and how to maximize health through diet changes. Patsy says, good afternoon from Lawrenceville, Georgia. Uh, Hello, thank you for joining us. And Shirley says, I explain things very clearly. Thank you so much. I appreciate that. I do love to educate. And so I appreciate you being here. John Paul says, hello. Hello, John. Um, Jennifer says, I wish you could be there. Yes, it's going to be a wonderful time. It's actually my first time going to Martha's Vineyard, so it's going to be great for me. Um, Marie says, good afternoon from Kennesaw, Georgia. Um, and says, thank you so much. Hello from Kampala, Uganda, in East Africa. Oh, wow, John. I grew up in Nairobi. So, yes, welcome from home. Brilliant presentation, John Kachago. Thank you. Another person from home. So, yes. Hi, how are you? Thank you for coming. So, if anyone has any questions about this or something else I may have spoken about before, I'll be more than happy to discuss them. If you think of something later, you can write the questions with the video, and I will see this, and I'll come back and I'll answer them. The other is, as part of a lot of the questions I've been getting, I have decided to have consultations where I can help people sort of get an idea of where their health status is. And so, if you look at the video, I posted the link, and I will post it again. And what that is, it's just a way to make an appointment, and so that I can, talk to you, go through your information, and kind of see where you need to focus and where to direct you next. So it's an actual health plan, and weight health plan specifically, but definitely, but I don't just focus on weight. You can't focus on weight. You always have to go after the cost, and there's always a health reason. Um, Marie says, good afternoon from Long Island. Thank you. Um, oh, so once diagnosed with, I'm assuming that means anemia, will you always be anemic? Is that the question, Valerie? Um, the way it came up is anime, but I'm assuming you're not talking about you've been diagnosed with a cartoon uh, character. So, um, so once you have anemia, no, you're not always anemic. So the way it depends on there's different types of anemia. The most common is from what's called microcytic anemia or iron deficiency anemia. And so usually replacing iron is helpful. Now, one of the tricks I used from someone who trained at Charles Drew, which is a very important hematologic or blood study place in Los Angeles, is that for those of us who are descended from or part of the African diaspora, who are descended or of African descent, the best way for us to reverse our our anemia is to treat it like sickle cell disease. And so taking iron alone is not as effective. We need to take iron, vitamin C, folic acid, and B12. That combination works best for reversing our anemia. So that's something you can talk to your doctor about. If you don't feel comfortable with the answer you're given, just ask for a referral to a hematologist and then look it up. So that, again, you can write this down: iron, vitamin C. And the reason you take vitamin C is because it increased the absorption of iron. Folic acid is another component of red blood cell production. And B12 is another that helps with a certain type of anemia. So you just kind of want to hit them all at once. Um, Shelley says, woohoo, East Africa is represented very much so. We got Kenya and Uganda in the house. Um, so in men's PSA test, part of routine workup, it should be. A PSA test should be done annually, and that's but it prostate cancer is one of those things where if it's caught early, you can reverse it and get it out. But if it's allowed to go for too long, then it becomes a problem. Now, there are some different schools of thought as to what you should do to intervene with a high PSA, but that's where urologists can come, can explain that a little better. And you can always get a second opinion. So Valerie said, thank you so much. Well, thank you. And thank you for coming. And I'm going to put, like I said, if I'm going to put the link in my page, it's probably the best place to put it. And what that is, again, is the opportunity to get a health consultation with me, at least to get a plan of action so that you can know where to look, know what you should do next, and how to actually kind of direct your physicians to, if you're kind of not sure where to go next and what to do next or who to speak to next, then that's just an opportunity for me to kind of gather all your information and give you an idea of where you can go. So if there are no more questions, thank you all for coming tonight. I always appreciate it, and I love to teach. And so any topics that you wanted me to cover, just let me know. I'll be more than happy at some point. Um, Great and fantastic presentation as usual, Dr. Timmer. Thank you so much. I really do appreciate that. And so, as some of you know, I've been doing this every Tuesday for over a year now. It's almost going on a year and a half. So obviously I enjoy it very much. And so if you have any questions, any concerns, or, just let me know, because there's always a way for us to connect in some way or another. So again, thank you for coming, and I will see you again right here next Tuesday at the Dr. Toomer Talk Show. Uh-oh, let me put my endings thing on.